I look at defending organisations and individuals who are being prosecuted by the Health and Safety Executive, for example, or Environment Agency or any other regulator that affects a business. So today we're looking at a healthy return to the workplace post-lockdown. And of course, this week really did see the start, or at least the beginnings of the start of the economy showing signs of normality, with shops opening up. And maybe you were part of the queues outside Primark or some of the other department stores that have opened up. Good, neither was I. So without much more of ado, let's crack into my presentation and see what my top tips are really for a healthy return to workplace post-lockdown. So on the first slide, what I've set out is really the context in which we find ourselves. So as always, a starting point when we look at health and safety within a workplace is to comply with the obligations that are set out in Section 2 and 3 of the Health and Safety at Work Act 1974, in which it says that all reasonably practicable steps must be taken so as to ensure the health and safety of the welfare of your workers and anyone else who is impacted by your operations. So this includes keeping up to date with work-related risks posed by COVID, as well as planning and implementing all reasonably practicable risk reduction methods and measures. There are also criminal law requirements under the Personal Protective Equipment at Work Regulations 1992 for businesses and employers to provide suitable PPE. Those obligations include that PPE must be appropriate for the risks and conditions involved, capable of fitting correctly, and must be assessed as suitable and effective so far as is reasonably practicable. I'll come back onto that phrase, reasonably practicable. I'll be mentioning it quite a few times as the session goes forward. It's quite an important point in health and safety legislation. Employees must be given the adequate information if you are giving them PPE, or if we're using PPE as part of our everyday work. And those obligations on businesses and companies, and obligations on individuals, is to keep those pieces of equipment clean, well maintained, and replaced as appropriate. Last but no means least, all responsible steps must be taken to ensure that any PPE is reasonably used. So, of course, if instructions are provided with regards to face masks in particular, which I'll come on to, being quite a hot topic and contentious topic, those instructions must be followed to the letter. One of the government's priorities, of course, is to assist employees and employers to return to a safe workplace. So on my next slide, I look at really what the government's checklist is, which we're all probably quite familiar with. So if we remind ourselves, the first point that they raised was work from home if you can, but for those who can't work from home, and for those workplaces that have not been told to close, staff should go to use your workplace if it's reasonably safe to do so. And there on my slide, I put, well, is it viable for clients, or what do we need to do with our reception areas or other communal areas that people are going to be congregating in? And those are really the key parts of your business, which you ought to be focusing on. The second government checklist point was to maintain 2 meters social distancing. Again, is this physically feasible in all workplaces? The other question mark, of course, is that we may well see that 2 meter social distancing being reduced in the near term. There's some talk, if it is reduced to, say, for example, 1 meter, which is what the WHO have recommended, whether there's a maximum time limit for people to be within that 1 meter social distancing zone. And there's some discussion as to whether that maximum time limit should be something like 90 minutes. So watch this space, I think, for that changing fairly soon, I think. The third point on the government checklist was to manage transmission risk. So where people can't be 2 meters apart, employers should be looking at putting in barriers in those shared spaces, creating workplace shift patterns, or fixing teams to minimize the number of people in contact with one another, or to ensure colleagues are facing away from each other, for example, in an office situation. Number 4 there is to reinforce cleaning procedures. So workplaces should be cleaned more frequently, paying close attention to high contact objects such as door handles and keyboards, and employers should be providing hand washing facilities and hand sanitizers at entry and exit points at at the least. And number 5 there, if all else is forgotten, this is really where the legal obligation rests. This is to carry out a COVID-19 risk assessment in consultation with workers or trade unions. So the guidance operates within the current health and safety and employment and equalities legislation, and employers will need to carry out COVID-19 risk assessments. And for those businesses where we have more than 50 employees, it's a requirement for those risk assessments to be published somewhere that people can log into and see that businesses have taken these risks on board and have set out their mitigating measures. And of course, most businesses will be setting out and undertaking risk assessments anyway, so hopefully this is not more of an obligation or more of a responsibility than what you already have. But the key point here is that it must be published if you have 50 or more employees on, say, for example, your website or somewhere which is accessible by various stakeholders, including members of the public. So if we turn to my next slide, this is where we really look at the COVID-19 risk assessment, or at least what I think ought to be done prior to actually putting pen to paper. So before the risk assessment is actually undertaken, consider who's doing what within your business and how, where they're doing it, why they're doing it, and what they are using to undertake their work. So for example, in an office-based situation, for me in particular, I use a keyboard and a laptop every day. I'll go to our canteen and our kitchens, and then I'll use mugs, glasses, crockery, cutlery, and those sorts of things. So I would expect those areas to be well maintained, cleaned on a regular basis, and also for maximum number of people to be in those positions, in those rooms at any one time. Of course, as part of our business, and hopefully as part of yours, we've been consulted as to what we think should be happening as part of our COVID-19 risk assessment. So consultation is really important going forward during the pandemic, and also going forward post-pandemic when measures have been relaxed, just to ensure that everyone is happy to work in the workplace without feeling that their safety is being compromised. And as I've said, publish your risk assessment if you've got 50 or more employees. A good way to do this is on your website if you have one, or if there is no website available, if you have a reception area, it might be a good idea to have your risk assessments printed out and placed in your reception area for people to take away, or if there's a computer screen for people to have a look at. So on my next slide, I'll really turn to what we call in risk management or compliance theory, this hierarchy of risk control. And as you can see, it's an inverted pyramid, and many of you may have seen this already, at the top of which we have elimination, which is the most effective means of controlling risk. And right at the bottom there, we've got PPE, personal protective equipment, which on the hierarchy of controls, at least anyway, is the least effective means of protection. And in between those two extremes, we have other measures that we can consider putting in place. So when we talk about elimination here, really, in terms of a pandemic, our only elimination is either lockdown or finding a vaccine. And of course, we've had lockdown already, and we're looking at easing those restrictions, and a vaccine is hopefully not too far off in the future. So what can we as businesses do, and what can we as employees and staff members do in the intervening period to ensure that we maintain a safe and healthy workplace? Well, there's really no substitution to the pandemic, of course. You can't replace it with something else, with another hazard. So realistically, we're looking at engineering controls or administrative controls in most cases. And those administrative controls I've tentatively put onto my next slide, which at the very start, we need to look at the risk assessment being bespoke. So if I just turn to my next slide, we look at such things as redesigning processes, for example, to allow physical distancing. So if you work in an office, or if you have an office or a factory that allows for physical distancing to take place, then of course we should have those measures taken in place. You can have physical barriers, for example, if you have filing cabinets, maybe put those as an island so that you create almost a one-way system around the office itself. If you have a factory setting, again, we can use measures such as coordinating how people work in their shifts, coordinating where people work on the factory floor, and cordoning off those areas so that only specific people can enter those areas at specific times. There are, of course, monitoring and detection technologies. So you may have seen in the news that certain companies are using, for example, technologies such as taking temperatures before people enter into the workplace, or taking temperatures of people throughout the day to ensure that they aren't presenting unknown to them with symptoms. Again, that's something to be used. All of these measures, I should say, are fraught with caveats in the sense of how accurate they are. So we need to take them with a bit of realism, in the sense of they may allude or may make mention or may alert us to the fact that somebody may be presenting with symptoms. But of course, at the end of the day, unless we've had a test itself to determine whether somebody's presenting with COVID symptoms and it's confirmed, then really all these are just mitigating measures. Again, screens and protection and ventilation play a key part in this, and ventilation especially, I'll come back to that point, which I think it is quite important, especially with hotels and hospitality and leisure opening up, hopefully by July, in the next few weeks, and also with dental practitioners, where aerosol generating procedures are created, and ventilation will provide hopefully an adequate source of mitigation. Lastly, there I've put PPE. Do you need it? And of course, there's quite a lot of discussion as to whether PPE A is effective, and B, if it is, in what situations ought it to be worn. Healthcare, of course, is mandatory, and using public transport, again, PPE or using face masks at least is mandatory before you step onto any public transport. There is, of course, a natural tension between if you're on public transport and then you walk into an office, there's no mandatory reason to use PPE when you walk into your private offices. So there is a natural tension between the guidance that the government has suggested for public transport and the guidance that is suggesting for offices and other businesses. What I would say, though, of course, is if you're using any measure, any PPE measure, you must document this in your risk assessment. And if you are going off onto sites, for example, if you're a surveyor, or if you are having to go to a client premises, undertake a dynamic site assessment or a risk assessment that you can then later on, either in your office or in your home, jot down what measures you've taken to ensure that you're mitigating away any risk to being infected by COVID-19. And as I say there, finally on this slide, document and store centrally all your risk assessments so that everyone within your organisation, so far as reasonably practicable, can have access to your risk assessments that you have produced, so that if not everyone, at least the majority of your business can understand what mitigating measures you have taken to ensure that anyone who works within the business or any visitors to your premises are being safeguarded against any possible exposure to COVID-19. So if I look at my next slide, I've listed there the sort of questions that I've faced fairly recently over the past week or so, which I was hoping to share with you. So one of the questions that I've been posed is, do I need to provide masks for my staff? And this is a really good question in the sense that it's very topical. And I would say that organisations need to provide necessary personal protective equipment and safe use guidance as appropriate. There's likely to be a significant rise in the demand for PPE generally, and without neglecting workers and refusing their requests for PPE, I think businesses and organisations need to be sensitive to workers' requirements following such a disruptive period that we've had. So my advice is to organisations and businesses is to support appropriate use of face coverings, for example, if it really does reduce spread to others as a complementary measure, whilst explaining its limitations. At the same time, I'd also urge to check your heating and ventilation and lighting and hygiene arrangements as a general point. At the same time, if the organisation is to ensure that PPE is invested in, make sure that investment is smart following long periods of downtime. Of course, many businesses will have been generating little to no income in some sectors. So ensure that any investments you make are those smart investments. And that's why the risk assessment itself, the procedure, taking a risk assessment, should establish what controls can be used prior to purchasing PPE, for example, and also to inform whether PPE should be required going forwards for your workforce. The other final point I'll make in respect of masks for staff is to make sure that they are what's called CE marked. So CE marking derives from European directives, and it means Conformité Européenne, and it's a mark that's defined as a European Union's mandatory conformity for regulating goods sold within the European market. So there's been, you may have seen this yourselves in the press, there's been certain PPE masks that have been sold without CE marking, which on the face of it would mean that they don't do what they're supposed to do, i.e. eliminate the risk of being infected by COVID-19. So ensure that whatever you're buying is to a European standard to ensure that you can tick off that box on your risk assessment. The other question that I've been asked recently is, as an employer, do we have a legal obligation to protect staff, and if so, to what standard? Yes, most countries, of course, impose an overarching duty of care on organisations to protect the safety and health of workers. And here in England and Wales and the rest of the UK, this is dictated by the Health and Safety at Work Act 1974 and the various regulations that are made under it. In most cases, this is enforced by the Health and Safety Executive, and in certain cases, again, it's enforced by the local authority. And in general terms, any breach of health and safety legislations and regulations is a criminal offence. So, so businesses and individuals can be open and be exposed to personal prosecution either by the Health and Safety Executive or by local authorities. So yes, as an employer, you do have legal obligations, and equally as an employee, you also have an obligation to ensure that you're taking on board all those measures that a company is providing to you and using, if it is PPE, using it appropriately. So there's an obligation on both employer and employee. A point that I mentioned right at the start was this point about ventilation. So I've been asked, specifically in the context of hospitality and healthcare, whether air conditioning is safe. And it's a very topical issue. I suspect that the question has come around and come about from a paper that was published in a journal called Emerging Infectious Diseases, where scientists studied an outbreak of COVID-19 among 3 families that had lunch at a restaurant in Guangzhou in China on January 23rd. The scientists there said that they believe the source of the virus in that particular restaurant was a 63-year-old woman who didn't show symptoms at the time. However, eventually through how they were seated and how the restaurant was operated, 9 other people got sick. But the really important point here is that 73 other people within that restaurant and 8 other workers weren't sick. So the researchers found that if you have air conditioning in your workplace, aerosol transmission of COVID-19 due to poor ventilation may explain why in that instance community spread of COVID-19 occurred. But if you have a well-functioning air conditioning system in restaurants that actively provides for appropriate amount of ventilation, then that would actually greatly lower the concentration of COVID-19 in the air. So in essence, what the research found was that ventilation and filtration provided by HVAC systems are said to reduce the airborne concentration of COVID-19 and thus reduce the risk of transmission through the air. A lot of study has happened between lockdown and this point now in terms of the use of air conditioning and HVAC systems. It still is an emerging area. And I guess what I would say is if you do have air conditioning units within your workplace and you do have a concern whether that's going to either spread or reduce the concentration of potential COVID-19 pathogen within the air, within your workplaces, then I'd recommend that you actually just turn to your manufacturer and ask them the question, what do I have installed? If it's installed properly, what are the chances that it's going to filter out and provide adequate fresh air ventilation within your workplaces? Like I say, ventilation is a very hot topic at the moment, and it's something that we just need to keep an eye on going forwards. So moving on to my next slide, I'm really looking at the Health and Safety Executive's position, and And what they have said is that they will be undertaking spot checks to ensure that businesses have taken on board their risk assessment properly and have implemented it. And indeed, the government's provided the Health and Safety Executive with a substantial budget to go away and investigate and undertake inspections. So the takeaway really here is that be warned and be prepared that the enforcing agencies really are taking this very seriously. And if they come across businesses who they think are flouting regulations and the guidance, then expect a knock at the door and expect difficult questions to be asked of what you're doing to mitigate those risks. Now, if employers, of course, comply with this Public Health England guidance, they are likely to be able to demonstrate reasonably practicable measures. So reasonably practicable is, on one hand, what's the risk? And on the other hand, how much money effectively do you have to spend to reduce that risk to a reasonably practicable level so that the population within your business and within your workforce are safe and kept away from harm with regards to COVID-19. So it's a balancing act in terms of cost and benefit, which is what the reasonable practicable test essentially asks you to do as a business. On the next slide, I've also said that the HSE have said that under what's called RIDDLE, or the Reporting of Injuries and Dangerous Diseases Occurrences Regulations, as a dangerous occurrence, COVID-19 related deaths have to be reported if an unintended incident leads to exposure at work. And it must be reported as a case of disease if an employee is diagnosed as having COVID-19 and there's evidence that it was caused by an exposure at work. Hopefully this will not be the case for anyone who's tuned into this, this webinar. But if it is, it's something to bear in mind, because of course RIDDLE itself has an obligation there that says that we must report certain dangerous occurrences to the Health and Safety Executive, and it's an offence if it's not undertaken. I've put there also some statistics which are slightly dated now, but the Health and Safety Executive said that between the 9th of March and the 26th of April, at that point, they'd received more than 4,000 workplace concerns relating to coronavirus. So there I've listed the top 3 industries which represented the highest proportion of those concerns. Manufacturing, unsurprisingly, came out at the top, and the health sector was number 3 there, with construction representing about 16-17% of those concerns. I suspect that has changed now, and I suspect it's going to change going forward, especially with the retail sector opening up. And I think we may well see a surge of coronavirus-related concerns originating from the hospitality and retail sector going forwards. So again, wait and see to what extent those statistics change. It would be quite interesting. Finally then, in summary, in terms of how we go about opening our workplaces and make sure that people are safe, really we need to engineer out risk and then add mitigation. So essentially, let's see if we can reduce, innovate and control how we go about opening up our workplaces. And a couple of things I've also put there in terms of engaging employees. There's this issue between fact versus perception. So for an effective, healthy return to the workplace, I think it's paramount to engage with your employees and support them as far as you can. So employees should be advised on the risks and how to minimise them without causing panic, of course, and staff should be consulted about any arrangement put in place to control those risks associated with COVID-19. So, for example, let's take this point about PPE and face masks again. In essence, if you're to put a face mask on, of course, it's a very visible thing and a very practical thing to do. So if you wear one, you can feel as though you've got some control over the pandemic and how you're exposed to it. And on one hand, scientists and some commentators are saying that there's some limited value in using face masks, but of course that's fact versus perception. So if we feel safer, then hopefully we'll ensure that our workplaces are maintained in a safe manner as well. The other point I've put there on the slide finally is to account for changes in behaviour, and by that I mean that we've had a long period of of time away from our usual workplaces. And that may well lead people to become either more suspicious or more impressionable. Above all, they may well be less willing to undertake any activities which in their perception increases risk, or that seems strange. So culturally, I think organisations should be prepared for a shift in terms of changes in behaviour and attitudes. Of course, isolation may have caused reintegration issues, so remote working will force a push, I think, and a demand for further remote working. So I think businesses ought to be planning for this change in behaviour. I've also put there, amplify those things that have worked well for your organisation. So say, for example, if remote working has worked well for you, maybe it's time to accelerate that within your workplace. And you may have seen also that productivity has increased for those people who are not having to commute, for example, to a workplace. And if for those people who are being able to communicate via Zoom and other platforms and being able to work in a more efficient way. So if I do have some concluding remarks, I'd probably say this. I'd say mitigate against regulatory actions and claims by leaning into the issues. So on my very final slide, it's tempting to say that we've got an issue, let's try to avoid that issue and let's not tackle it, or let's put it off for another day. But let's lean into those issues and tackle them head on. And I think that's the way that you're really going to mitigate against any regulatory action, especially with a health and safety executive having this fairly large budget to go away and knock on business doors and see what mitigating measures you put in place. And of course, lastly, help is at hand. The Chamber here has a fantastic reputation to assist businesses, and of course there are a number of advisors in and around the area to assist you going forward should you have any issues. Thank you ever so much. I'm more than happy to take some questions.
Perfect. Thank you, Kamal. I hope everyone found that useful. We haven't got any questions in the chat box at the moment. Does anyone want to ask one whilst we've got Kamal? Any burning questions? I'll just wait for 2 minutes just to see if anyone pops one in. Okay, we've got a really nice comment saying none from me, but really useful, thank you. And then we've got another question asking if the slides will be available.
More than happy to make those slides available, and I think we can send those to you, Yasmin, for onward distribution.
Perfect, yeah, no problem at all. We've got another question. How much risk assessment documentation do I need to share with staff?
It's a really great question. What I would say is that try to make any risk assessment or any business document really as concise as it can be, so that it's readily understood by the workforce generally. In terms of consultation, it's best to go with a mindset that if you consult fully with somebody, then you're likely to get back a better result at the end of the process. So I would say that if you have, for example, if you have a workforce or population in your workforce that's represented by, say, for example, union memberships or by representatives of various departments, I would ask those people what are the burning issues within their departments, and then filter that back into your risk assessment methodology. So I would say try to make your risk assessments as concise as possible, but try to get as much information and much discussion from the relevant people within your businesses, so that any risk assessment really is relevant to what you really need to risk assess.
Perfect, thank you. We've got a couple more questions coming now. So the next one is, I coordinate student work placements. How can I advise employers from September?
So from that question, I'm assuming that we are looking at students going into workplaces either for part of their studies or for work experience. There are actually specific rules and regulations, you won't be surprised to hear, with regards to vulnerable people going into workplace, and that includes students and pupils. So What I would ask if I was in that situation from the prospective employer is, please can I have a look at your policies and procedures? Can I please have a look at your risk assessments as to how you are implementing your risk assessments following from dealing with a pandemic, and then take that into consideration and share that with the student population to show them this is what this workplace has in place for you when you enter, and are you comfortable attending that workplace. To a certain extent, we're in uncharted territory in terms of how aggressive this virus is. But at the same time, we just need to be mindful that we take into consideration those sort of that hierarchy of risk control that I made mention of earlier, in terms of taking sensible precautions to ensure that we are trying to reduce, as reasonably practicable, the exposure to any risks associated with COVID-19.
Okay, thank you. Next question is, what process should we go through for employees who are shielding to bring them back safely?
In terms of those who are shielded, I would say, first and foremost, make sure that we've consulted with them to set out what measures we have or what measures we are intending to put in place within a business, and specifically in respect of their work. So if it's an office-based position, whether in fact they'll be coming across different people at different times of the day, or whether we can stagger their shift patterns so that it eliminates that risk of coming into contact with other people. And ultimately, if it's a person that is shielded and if they can work from home and if they do feel vulnerable, then it's going to have to be, I think, a discussion with employer and employers to, if you can work from home, please try to maintain that, please try to do so it mitigates away from you being exposed to any virus in the workplace. Generally, of course, if they do need to come in, we'll need to consider how they can be kept away from or unnecessarily be exposed to other people within the workplace. So I think it's going to have to be an open dialogue with that, with those people who are shielded currently, and to see how they feel comfortable returning back to the workplace, and what measures we can practically put in place to make sure that they are comfortable. Okay,
thank you. Next question is, can I get a copy of the PowerPoint, please, included in PPE? Should rubber gloves be used?
Again, rubber gloves depends on your risk assessment and what that brings about. I've seen a number of people wear disposable gloves, so anything from retail stores, sandwich shops, for example, all the way through to in an office environment when people are getting up to go to their kitchen areas. I think that's really going to be based on your risk assessments and how effective you think rubber gloves are going to be within your business. And if it's a manufacturing business, for example, I suspect you will be wearing other PPE anyway. If it's a customer-faced role, maybe in reality it's not going to affect the customer too much, or it's not going to affect how you undertake your role too much. But again, we come back to fact and perception. So if you think that your customers are going to feel safer being in and around your business or dealing with you, then by all means consider wearing rubber gloves. The caveat to all of this, and the caveat to PPE generally, as I've mentioned, is to ensure it does what it's designed to do. So make sure it has the appropriate CE marking, make sure that if it is for a specific use, that it covers that use, and ultimately that you've really considered it within your risk assessment. So if you are using rubber gloves, face masks, etc., you've set out why you think your business requires its use and how you've informed those people who are going to use it, how you've informed them to use it properly.
Perfect, thank you. Next, Andrea's asked a question to the group. So does anyone here have any good practice on creating fixed teams and new smaller working groups? So if anyone does, if you could share that in the group chat for Andrea, that would be fab. And then we've got another question to Kamal. How can you control outside contact from deliveries?
So I'm assuming that with that we mean parcels, for example, post coming into the business, or deliveries generally. A number of delivery companies that I've seen personally are leaving, for example, parcels and mail in a specific point within an office. So if I take our office, for example, we have a designated area for deliveries to be received. If those deliveries ordinarily are to be signed for or require recording, then those delivery companies are taking photographs of them, which is fine with us. But what we are putting in place is a specific point for those deliveries and those collections also to be made. So I guess the way to look at it, and again, this depends on whether an organisation and whether a business really has space to do this, I guess, is to cordon off a specific area for those people who are making those deliveries to make those deliveries and leave them in that one place, and then for one person within the business to either distribute those deliveries that are taken, or at least make people who need to be made aware that those deliveries have come in. So it's all about minimising who's in contact with A, the person who's delivering it, and B, the delivery itself, because there's some question mark as to how long the virus can remain on hard surfaces, for example, or within packaging. So again, if it is somebody who's dealing with deliveries on a hour by hour basis, maybe it is that person maybe could benefit from wearing rubber gloves or wearing PPE that will eliminate them being exposed to COVID, and also, arguably it'll make them feel safer that they can undertake that task in a safe and well manner.
Okay, thank you. Next is a really nice comment from Pam. And then Andrea's put her email address if time runs out. And then the next question is, our employee is shielding but normally works in other people's homes. Is it likely that he will not be able to return to his role even if shielding ends?
Really tricky question, because then you've got the issue with the employee, but also the issue with the person that they're caring for, and whether in fact the person that they're caring for wishes them to come into their home, and if so, what precautions need to be taken at that point. So domiciliary care, for example, and care generally is a really tricky place to be in at the moment. And for those who are shielding, once shielding ends, and if they're in that role, I would suggest, of course, if they're comfortable to do so, undertake a risk assessment, really. And also, if they are seeing 1 or 2 or 3 clients, ensure that those clients' premises are safe for that person to enter into, and of course give that person the appropriate PPE, so be it face masks, be it aprons, or be it rubber gloves, or a mix between all 3 of those. And it's making sure that everyone in that situation is comfortable. You can't, like we said earlier, really in a hierarchy of control, elimination is either a vaccine or lockdown here, and arguably neither are within our gift. So we really need to look at mitigating measures and mitigating it to as low as reasonably practicable. So in that situation, once shielding ends, and if that person is happy, and we as an employer are happy for that person to go back into the workplace, then I think those measures ought to be recorded in a risk assessment, and then for that person to ultimately feel comfortable that the PPE that they've been provided, if they require it, is enough for them to feel safe to undertake that role.
Perfect, thank you. Next is Pia's just shared what her company are doing. So we're labelling deliveries with the last date they were touched, and then leaving them in a designated area to quarantine them for 72 hours in line with current guidance, and gloves to be used too. And then we've got another question. How can you make sure you distance when people use the toilets?
A tricky question, of course. I think again from our experience, so talking about HCR's experience in this, we've as our offices have gradually opened, we've filmed, believe it or not, we've filmed how to enter and work in our offices during these strange times. And one of those elements has been using the toilets, of course. And the system that we have devised, it may sound rudimentary, but I think it's effective actually, is that of course only one person can enter the toilets at any one time. And we have a simple cone mechanism outside whereby we put a cone to alert that the facilities are being used, and once those facilities have been vacated, we put the cone to one side. So again, it's going to depend on the size of your premises and the size of your office buildings and the facilities that you really have in place. And if you're over multiple floors, that may well be easier. But from our perspective, we've taken sort of an approach of one person at one time with an alert by the door to say that it's being used.
Okay, perfect. And I think, unless anyone else has got any questions, I think that's it. So just from me, thank you very, very much for sharing your knowledge with us, Kamal, and taking the time out to present to us today. We have just had another comment. Sorry, I'm just going to read this out from Pia. We have a system for our toilets as we have multiple cubicles in each one. We have identified what the max capacity is. Then the door to the toilets will be clearly labelled as such. We will be putting hooks on the doors to the toilet so that you can tell if a toilet is full or not. And you hang up your lanyard on the door.
That seems like a good idea. One thing I failed to mention actually, we've also implemented almost, if you imagine a credit card with a sort of an arc cut out of it, we're using that as door openers, so rigid plastic door openers to mitigate away the use of using your hands on a sort of a high contact area. So again, from that comment, actually, that sounds like quite a good idea, that have actually assessed the maximum capacity. And like I say, we're using other implements to open up those sort of sensitive areas.
Okay, well, thank you both for sharing best practice. I think that's pretty much it. If anyone has got any questions for Kamal in the meantime, I'm sure he won't mind if you email me and I could forward them on to him to answer the question for you. But other than that, thank you very much again, Kamal, for taking the time to present to us. Just before you go, if I could just go through what webinars the Chamber are hosting next week. So Monday 12 till 1, we've got Preventing and Managing COVID Outbreaks delivered by the NHS. And Wednesday 3 till 4, we've got an introduction to risk assessment, and that's delivered by our HR Director, Dawn. All of our webinars are free for members and non-members, so if you know anyone that would like to book on or would benefit from them, then please let me know. But I think that brings us to the end. Thank you all for joining, and I hope you have a lovely afternoon, and thank you to Harrison Clark Rickerbys for presenting to us today. Everyone take care and goodbye.
Thank you.